Ladies and gentlemen, a warm welcome to each and every one of you. I am Kemal Duyar, and it is a pleasure to stand before such a distinguished gathering. Many familiar faces are here, and for those who haven't had a chance to meet me yet, I am delighted to introduce myself. As we embark on this journey together, I can't help but express my sincere joy in having you all here today. Your presence adds immense value to our inaugural event, marking the beginning of a series we proudly call Yücelen Health Days. Throughout our time together, our esteemed speakers will shed lights on the realms of physiotherapy and rehabilitations, delving into the crucial significance of a psychological approach in addressing health issues associated with pain. This promises to be an enlightening and transformative experience, one that we hope sets the tone for many more enlightening gatherings to follow. Once again, welcome and thank you for joining us on this auspicious occasion. Let the Yücelen Health Days commence. Following each presentation, our speakers are eager to engage with you and address any questions you may have. Subsequently, we will treat you to a captivating video introducing our hospital, where Ms. Emma will share valuable insights about the Yücelen hospital groups. I invite Ms. Emma to stay.
Hello everybody. First of all, I'd like to thank you all for taking the time to be here today with us at Yücelen Hospitals. It's a pleasure for me to share this experience with you, and I hope you all enjoy the event today. My name's Emma, I'm from the Health and Tourism Department at Yücelen Hospitals. And first of all, I'd like to give you a bit of background information about the Yücelen Health Group. It's an establishment founded by a group of people led by Hamdi Yücel Gürsoy in 1996. We proudly provide the best healthcare services in the Muğla area. We have 3 different hospitals. The first one being in Muğla in the city centre, which is the biggest. Then we have our Ortaca branch, which along with the healthcare in the hospital, there is also a hemodialysis centre which provides care. And then finally here, where we are today in Marmaris, which provides healthcare to the locals and the tourists that visit the port town. We have 75 patient beds here in the Marmaris Hospital, 17 of which are in the intensive care unit. There are 19 polyclinics, which are spread across the 2 buildings here. We also have agreements with many of the large hotels in Marmaris to provide healthcare services in many languages, including English, Russian, German and French. And our professional healthcare team are always here to help with any queries or health requests that you may have. We are very proud to be offering a high quality service for many years. These include tailor-made treatment packages, meet and greets at the airport, helping and assisting patients during their hospital experience. We also like to help and assist with registration, examinations, treatments, insurance procedures, discharge, and of course translation services. The medical reports written by the doctors are translated by our professional team into English, German or Russian, and we are proud to assist you with the tailor-made services in the healthcare centres. I hope this little introduction has been beneficial, and thank you very much once again for being here today. Thank you.
Thank you, Ms. Elma, for providing us with a glimpse of info to the heart of Yücelen hospitals. Now, without further ado, I invite Ms. Aygün Cahangirova, a distinguished physical therapy and rehabilitation specialist from our hospital, to grace the stage and share her expertise.
Hello everyone, good afternoon and welcome. My name is Aygün Cahangirova. I am doctor specialized in physiotherapy, medical and rehabilitation. As you can see on screen, we were going to talk about skeletal and muscle systems. And I want to begin with questions, with following question. Do you know in which cases you should make an appointment to a physiotherapist, and how can we help you? So I am going to tell you about 3 major problems that we interested with osteoporosis, pain, and rehabilitation. So I want to begin with osteoporosis. Osteoporosis characterized by low bone mass that can lead to decreased strength and increased risk of fracture. And it is a serious problem, it's a very common disease, but most of cases osteoporosis are asymptomatic. So people don't know if they have the disease until fracture occurs. And its prevalence increases with age. And as I say, the fracture may be the first symptom, and it's cause important secondary health problems and even death. So femoral fractures in the elderly causes 15–20% of deaths within the first year, and 50% of patients became dependent on them. And as you can see in graph, osteoporotic fractures are more common than all the other major health problems, such as stroke, heart attacks, breast cancer in women. The purpose of this information is to draw your attention to this disease. It is important to make diagnosis on time until fracture occurs. I often see people leaving the orthopedic clinics with a cast as a result fracture after minor injury, especially in older people. So how we can diagnose osteoporosis, and who should have screening or check-up of osteoporosis? And the National Osteoporosis Foundation recommends bone mineral density testing in women age 65 and older, and men age 17 and older, in postmenopausal women and men above age 50 and 69, who has a risk factor profile. and in postmenopausal women and men age 50 and older who have had an adult age fracture. Which risk fracture we mean? It is low body mass index, people who use for excessive caffeine, alcohol users, 3 units and over daily, and people who smoking and vitamin D deficiency, low calcium, and who has family history of hip fracture. And secondary causes of osteoporosis, some disease such as rheumatoid arthritis, chronic gastrointestinal system disease, chronic obstructive pulmonary disease, and type 1 diabetes, chronic liver disease, or who has organ transplantation, and some medicines such as corticosteroids over 3 months. What about treatment and lifestyle adaptation? Treatment of osteoporosis includes some medicines if needed, and balanced vitamin D and calcium intake, and exercise and lifestyle intervention is an important component of prevention and treatment osteoporosis. Because exercise, they stimulate bone growth. It's named osteogenesis. Which exercise we offer? Firstly, weight burning aerobic exercise, such as walking, stair climbing, jogging, and dancing. Next exercise, range or resistance exercises, especially around hip and spine. And no less important place take stability and balance exercise that makes falls less likely. Another very important problem that varies people is pain. Pain is most common symptom of musculoskeletal disorders, and can be caused by disorders of bones, joints, muscles, tendons, ligaments, and combination. I will begin with trigger point or myofascial pain syndrome. Trigger point is small bump or nodule in muscles that cause pain when touched and sometimes when they are not touched. And it is accompanied myofascial pain syndrome. It is a chronic condition that affects muscles and the fascia around them. What causes myofascial pain syndrome? It is maybe poor posture, repetitive motions, muscle injuries, and risk factors are muscle weakness, walking or living in a cold environment, emotional stress, some metabolic disease, sometimes deficiency of vitamin D, and anemia. What about treatment? We have invasive techniques and non-invasive techniques. As you can see, dry needling, trigger point injection, and neural therapy. Non-invasive techniques include drug therapy, exercise treatments, physical therapy, and SWT, extracorporeal shock wave therapy. I would like to focus you on SWT. We can use SWT in such disorders. SWT is non-technique sends acoustic shock waves into the bone and soft tissue, increasing in metabolism at the cellular level that increase revascularization, cause revascularization and recovery. And we use SWT in such diseases as tennis elbow, shoulder cuff, and frozen shoulder, Achilles tendonitis, plantar fasciitis, and it is the first choice in treatment of calcaneus spur. Another important and common complaint, spine pain, especially neck and back pain, because cervical area and lumbar area more mobile, and have weight-bearing function. The thoracic spine is more rigid, and it is less likely to be injured. I would like to give you information why you should start with conservative treatment. Up to 84% of adults have low back pain at some time in their lives. So about 20% of people develop chronic low back pain lasts 12 weeks or longer. Acute pain lasts 4 weeks. And approximately 19% of cases it's temporary and pain improves without surgery. And surgery we performed by reason of back pain generally are not successfully. So we offer first-line conservative treatment, and when surgery is necessary, it is important to know spinal surgery has a role in pain and disability resulting from neural compression, or when back pain related to cancer, infection, or growth instability. Another reason are pains that last for a long time and impair quality of life, non-effective medical and physical therapy. As you can see in picture, there are 4 stages of dyscardiation. Even a 4th stage in the absence of these symptoms, as you can see, neurologic deficits such weakness or loss of normal bowel and bladder function, surgery is not indicated. You can see cause of low back pain. It's necessary to know that the cause of low back pain have a spinal pathology such as spinal infection, tumor, and fractures. The goal of medical examination is to detection the rare serious cases. And MRI scan is the gold standard investigation in back pain. Non-surgical treatment include pharmacological treatments, local and trigger point injection, and physical modalities, exercise manipulation. And for subacute and chronic low back pain, include cognitive behavioral therapy and education, back school. The next diseases is osteoarthritis. Osteoarthritis is a chronic progressive joint disease with gradual destruction and loss of cartilage and a subchondral bone, leading to inflammation and joint dysfunction. The important signs of osteoarthritis, pain, tenderness, limitation of range, and frequently affect joint joints that have a weight-bearing function as knee, hip, and other shoulder, spine, finger, and toe joints. I want to tell about knee arthritis, a very common arthritis in the patient. It's affected approximately 10% of the global population, especially women between the age of 50 and 60 years. You can see 4 stages of osteoarthritis, and the process begins with destruction of cartilage. Then the spaces between bones is narrowing, and the bone and third level, the destruction reaches the bone, and finally the joint space is significantly reduced. Treatment. Treatment of osteoporosis started with conservative treatment. This exercises, physiotherapy, medication, and joint exertion, and weight loss overweight patients. And I would draw your attention to physical exercises and physical therapy and pain medication are used in time if necessary, and many arthritis don't need surgical intervention for a long time. Joint injections. Which joint injection we use? it is corticosteroid, hyaluronic acid, PRP, and mesenchymal stem cells. First-line corticosteroid with injection are widely used in acute inflammatory states when patients have a complaint such as swelling, pain, tenderness. Another choice is platelet-rich plasma. It is autologous plasma. You know that platelets are small blood cells that are responsible for clotting and stopping bleeding. And another function of platelets is release growth factors, cytokines, proteins such that stimulate collagen and hyaluronic acid, promote tissue healing and repair. We use PRP also in treatment of tendinous, ligamentous, cartilaginous, and muscular injuries. How we prepare the PRP? I would like shortly to introduce you to the process of preparing. As you can see, firstly, we call it blood. Then we're using centrifuge to separate platelets, and we extract platelet-rich plasma. Hyaluronic acid. In 1997, the Food and Drug Administration approved using hyaluronic acid as a technique, as a conservative technique in osteoporosis management. Hyaluronic acid is a natural component of synovial fluid joints, and they function increasing fluid viscosity, lubricate the joint, and absorb shocks during movements, and inhibits cartilage degradation and stimulates the synthesis of endogenous hyaluronic acid. Another choice, mesenchymal stem cells. This procedure is performed by orthopedics clinic in the operating room. These cells are collected from adipose tissue and marrow bone, produce growth factor, and they have functional. They can transfer to many different cell types, especially bone and cartilage, and with cells can restore, has ability to restore damaged structure when introduced into damaged tissue. You can see injection which we do in our clinics. This injection different joints, elbow, fingers, knee, and ankle. Shoulder pain, it's another and take third place after back and knee pains. It's common disease, and cause of shoulder pain may be from shoulder, and referred pain from neck, pain from longer malignancy or heart as ischemia. And cause of shoulder pain may be rotator cuff T, tendinitis, rheumatoid arthritis, trauma. I want to tell about frozen shoulder. Prolonged pain cause frozen shoulder. It is loss of both active and passive shoulder movement. And pain can be worse at night. You can see a patient who has frozen shoulder, and you can see how her passive motion is restricted. The reason of restriction of movement is in which in a patient prolonged immobilization. What we do in this situation, the goal of treatment is reduce pain and improve range of motion. We use anti-inflammatory medicines, painkillers. If they ineffective, we use local steroid injection and physical therapy. In physical therapy, we use with modalities, hot or cold therapy depend on the situation, transcutaneous electronode stimulation, ultrasound therapy, laser therapy, and SOT. Therapeutic exercises includes exercise to improve the flexibility, strength, and stability of muscles around joints. And also very important part of our department is rehabilitation. You know, rehabilitation divided on orthopedic, post-surgery rehabilitation, and neurological rehabilitation. Post-surgery rehabilitation, I think that every patient, especially older patients, after operations such as joint implantation, after fractures, after operation on nerves, tendons, muscles, arthroscopic operation, as well as neurosurgical operation on the spine, need professional rehabilitation to restore mobility of joints and limbs, balance, breathing, increasing muscle strength, reducing pain and fear of, reduction of anxiety before moving. The goal of post-surgery rehabilitation: regain independence and return to usual daily activities. You can see our patients after surgery on worst on bones and tendons, and another patient. After arthroscopic operation of knee. What about neurological rehabilitation? Neurological rehabilitation, you know, it is rehabilitation need for patient after stroke, multiple sclerosis, Parkinson, after injury, brain injury, for children with diagnosed spina bifida, cerebral palsy. I will tell you about stroke because it's most prevalent neurological conditions worldwide. And you know that disability associated with stroke, it is motor impairment. And the goal of stroke rehabilitation is improve patient quality of life, to regain strength and mobility. Researchers have found that people who participated in targets and planning stroke rehabilitation program perform better than people who don't have stroke rehabilitation. The rate of recovery is generally greatest in the weeks and months after stroke. So rehabilitation should be started as soon as possible after initial stabilization has occurred. But despite the fact that majority of recovery occurs within the 3 to 6 months, neurosurgical recovery may continue for years. For we offer rehabilitation should continue in subsequent stage of the disease. The recovery and compensation of impairment motor function after stroke are supported by function of brain as neuroplasticity. Neuroplasticity is the brain ability to modify neuronal activity and reorganize neural connections. You can see our patient after 1 month rehabilitation. Neurological rehabilitation include physical activities and occupational therapy. There is balance therapy.
My name is William John Pritchard. Lived in Turkey now for 14 years. Beginning of January, I was diagnosed with a broken wrist. I come here at the Yücelen for treatment, and the treatment has been very, very good. I would recommend Yücelen for any treatment for people. This hospital has been very, very good, and especially for foreign people, most understanding.
It is one of our patient after treatment, and thank you for listening to me. Now there will be a brief video presentation of our physiotherapy-oriented check-up programs. Thank you.
Hi, my name's Emma, and today I would like to give you some information about our physiotherapy and rehabilitation programs. We are here today in our Marmaris branch of the Yücelen hospitals in the Physiotherapy and Rehabilitation Centre. First of all, we have 3 7-day packages. The first is for knee osteoarthritis, the second for osteoporosis, and the third for fibromyalgia and muscle pain. We have 4 15-day packages available. These include spinal disease, shoulder pain, after orthopaedic operations and after strokes. All of these packages include examinations with our specialist doctors, all of the required blood tests and a treatment plan tailored to your needs. Depending on the patient's background, any extra treatments or specialist requirements will also be tailored for. We are here at our Marmaris Yücelen Hospital in the Physical Therapy and Rehabilitation Centre, ready to take care of you and any of your needs and requirements. We look forward to seeing you soon.
Thank you, Dr. Cahangirova, for your enlightening presentation. Next, let's welcome Gülfem Özçelik, a dedicated psychologist from our hospital, as she takes the stage to impart her knowledge.
Thank you. Welcome everyone. First of all, thank you for participating in our Health Days event today. I'm not comfortable with the microphone, just forgive me in advance. It's such a great honor me to present my presentation in front of you. I try to imagine, or let's say I assume that it's not easy to live in a foreign country, especially because of the language barriers that you may face during your life. Because of that reason, as Yücelen Hospital, we are trying to provide you with English-speaking professionals in order to eliminate these barriers in your lives. I'm going to try shed light on psychological approaches towards pain-related health problems. Firstly, I will just go over my content. I will address the biopsychosocial model in order to the relate in your mind, where does this relation come from, like chronic pain and the psychology. Then I move on definition of chronic pain, then I will go through the pain perception, attention and anxiety. And at the end, I will cover the treatment part. And at the really very end, we will do mindfulness breathing exercise together. Hope you will enjoy. I will begin with the biopsychosocial model because as human we are not only biological creatures, as you can guess, we are also surrounded by many other social realities, social lives as well, but we are also psychological, we have also psychological components that are also related to our mental states, our well-being and esteem, whatever it calls. So we are standing in the intersection of those three components, three concepts. So it is related. According to biopsychosocial model, we are not mere passive recipients, but instead we actively make meanings out of everything, and we make any inferences what we face during our lives. And especially in times of stress, we make an automatic responses, and we easily make a conclusion about what we should be done without investigating where does it come from. We just give automatic responses mostly during the stress. However, sometimes we need to find out the antecedents of that conclusion. We need to find out where does this automatic response come from. That is why biopsychosocial model concerns with the chronic pain. I just briefly define the chronic pain. Chronic pain is that the pain lasts more than 3 months or beyond expected healing times. As you may all experience this, as it persists, people suffer from different kinds of things because they just isolate themselves from their social surroundings. They just inhibit themselves from their social surroundings. Because of that, they will not get any support from their social surroundings as well. So their interpersonal relationships are disrupted, and their lifestyles, even their careers may be also disrupted during that time. So not surprisingly, their overall well-being will be diminished. Chronic pain has negative impact on their health and their quality of life, not surprisingly. So it is associated with negative moods, physical dysfunction, and it also contributes to depression. Clearly, at some point, chronic pain should be supported by psychological treatment as well as the physical rehabilitation. While we are talking about the chronic pain, the chronic pain is related to perception, of course. The perception of pain involves more than a mere sensation. Certain brain chemicals, also the certain brain parts, are all responsible for those pain perception process. So attention, anxiety, memory, and learned pain also have a crucial role in this pain perception process. So the psychological treatment should be there, and it is an inevitable part of this process. I'll just try to address the attention part. Just try to remind yourself when you were in pain. Where does your attention go? I guess not surprisingly, you direct your attention towards the pain mostly, because as you direct your attention, it makes the pain even worse. Especially the people who are more sensitive or just oversensitive or overvigilant about their bodily sensations, their health, will be also affected this chronic pain. Only just attending to these sensations make someone even more vulnerable, maybe fragile, or just it makes the pain unbearable. In studies, it is found that practically pain can be reduced by only just distracting one's attention. In an experiment, they conduct an experiment for that reason, and then they found out that during the burn treatment procedures, patients reported less pain perception if they were distracted by virtual reality type of video games compared to who were not distracted by anything. So it can be said that practically pain can be reduced by distracting one's attention. Anxiety is also another component, as you may all experience during your daily life as well. Anxiety is a contagious thing, and it can be reflected just mimics, tone of voices, and using words may be also responsible for anxiety. Anxiety, fear, and sense of control, they all influence the patients who suffer from pain. If the patients feel as if they are losing their control, they will become more anxious, agitated, and it triggers the pain even more. So during the procedure, during the chronic pain treatment, the elimination of anxiety-provoking words and anxiety-provoking items will be easily gives us a tool that we can provide them with thorough explanations in that sense, and that giving them a clear mindset, then it will make them more clearer, and they will be more relaxed, and they will be less worried about their pain. As psychologist, what I will do during this chronic pain treatment is cognitive behavioral therapy. Cognitive behavioral therapy has three parts. There's thoughts, emotions, and behaviors. And as you can see from the diagram, they are all interrelated to each other, and we need to find out each processes one by one. And during this psychological treatment, we just train our clients to monitor their thoughts and their emotions, so they can find out that are they maladaptive or are they adaptive during this period, and then only just focusing on maladaptive and adaptive thoughts and to try to discriminate them will be beneficial. And eventually, at the end, during this treatment, we try to facilitate adaptive cognitions and replace the maladaptive cognitions with the more adaptive one. And another technique that that I use during this chronic pain treatment will be mindfulness-based stress reduction. In mindfulness-based stress reduction, we are just train our patients then about the meaning of the mindfulness. Maybe you may heard the terms like mindfulness in your daily life. Anyone wants to share? Or? Okay. One. You may raise your hand. Anyone? Not too much. Okay. Like I will just basically define the mindfulness. Mindfulness has been described as a process of bringing certain quality of attention to moment-by-moment experience. It is used for increasing awareness and responding smartly to mental processes, such mental processes that we talked about in cognitive behavioral therapy. These are the maladaptive behaviors mostly. Then we need to address those maladaptive thoughts during this mindfulness processes as well. Therefore, mindfulness begins by bringing awareness to current experience like an observer. Clients are trained to observe and attend to changing field of their thoughts, feelings, and sensations from moment to moment. Eventually, they will monitor their thoughts and feelings, which is occurring here and now. Mindfulness is a type of meditation in which you focus on being intensely aware of what you are sensing and feeling in the moment, and without interpretation and without any judgment. Just practicing mindfulness involves like breathing methods that we will do today, guided imagery, and other practices to relax the body and mind and help to reduce stress. As I know from my earlier experience, what I listen will be forgotten if it's not practiced well or it is not rehearsed well. So let's practice together if you want to join me. We will do breathing exercise together. Just start by settling into a comfortable position. Okay. You may feel the ground under your feet. Okay. Allow your eyes to close, maybe. Or you can also keep them open, whatever you want. Just begin by taking several long, slow, deep breaths. Breathing in fully and exhaling fully. Breathe in through your nose and out through your nose or mouth. Allow your breath to find its own natural rhythm. Bring your full attention to noticing each in-breath, and as it enters your nostrils, travels down to your lungs and causes your belly to expand. And notice each out-breath as your belly contracts and air moves up through the lungs, back up through the nostrils or mouth. Just invite your full attention to flow with your breath. Notice how the inhale is different from the exhale. You may experience the air as cool as it enters your nose and warm as you exhale. As you turn more deeply inward, begin to let go of noises around you. If you are distracted by sounds in the room, simply notice them and then bring your intention back to your breath. Simply breathe as you breathe, not striving to change anything about your breath. Don't try to control your breath in any way. Observe and accept your experience in this moment without judgment, paying attention to each inhale and exhale. If your mind wanders thoughts, plans, or problems, simply notice your mind wandering. Watch the thought as it enters your awareness as naturally as possible. Then practice letting go of the thoughts as if it were a leaf floating down a stream. In your mind, place each thought that arises on a leaf and watch as it floats out of sight down the stream. Then bring your attention back to your breath. Your breath is an anchor you can return over and over again when you become distracted by thoughts. Notice when your mind has wandered. Observe the types of thoughts that hook or distract you. Noticing is the richest part of learning. With this knowledge, you can strengthen your ability to detach from thoughts and mindfully focus your awareness back on the qualities of your breath. Practice coming home to the breath with your full attention, watching the gentle rise of stomach on the in-breath and relaxing, letting go on the out-breath. Allow yourself to be complete with your breath as it flows in and out. You might become distracted by pain or discomfort in the body, or twitching or itching sensations that draw your attention away from the breath. You might also notice feelings arising, perhaps sadness or happiness, frustration or contentment. Acknowledge whatever comes up, including thoughts or stories about your experience. Simply notice where your mind went without judgment, pushing it away, clinging to it, or wishing it were different. And simply refocus your mind and guide your attention back to your breath. Breathe in and breathe out. Follow the air all the way in and all the way out. Mindfully be present moment by moment with your breath. If your mind wanders away from your breath, just notice without judging it. Be it a thought, emotion, or sensation that hooks your attention, and gently guide your awareness back to your breathing. As this practice comes to an end, slowly allow your attention to expand and notice your entire body, and then beyond your body to the room you are in. When you are ready, open your eyes and come back fully alert and awake. The breath is always with you as a refocusing tool to bring you back to the present moment. Anyone? Anyone can share his or her experience? Was it good or? Thank you.
I started doing that when I was having cancer treatment, and especially when you can't sleep because it's all going through your mind, that is the best thing you can do. It makes such a difference.
You are familiar with this technique, so thank you very much for sharing. Anyone else? Anyone else? Okay. Thanks for joining today. It's my end of my presentation. Thanks for joining us.
Thank you, Mr. Özçelik, for shedding light on crucial aspects of psychological approach in physiotherapy and healthcare. Today is a special day for Yücelen family as well, because quite interestingly, both of our speakers' birthdays are today. So I would like to invite them back to the stage to celebrate.
Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you.
You also saw the baby, which is handsome Luca. As we draw closer to the conclusion of our event, brace yourself for a special surprise draw, an opportunity for you to partake in a moment of excitement and anticipation. Get ready for a delightful surprise as we reveal something special just for you. Also, you can follow us on our social media sites. So our presentations are over for today. I invite you back to where the music and treats are, for the special surprise draw will be there. Thank you for joining us today. I hope this will be first of many to come later on, which gets anxiety from both of our ends. Thank you.